Ethical dilemmas in neonatology. The world of neonatology has become one of the most controversial areas in medicine. As a result, the ethical dilemmas that surround this area of medicine are highly unprecedented and unavoidable to both physicians and the parents of these children. However, decision-making seems to be the common denominator amongst this specialty. There are so many risk factors that tie in with neonatology and neonatal intensive care units. Parents are terrified of the new technology that their children are being treated with and the long-term effects associated with these treatments, and then providers, on the other hand, are being criticized for the types of treatments that they subject their patients to and the safety hazards that come with them, even when the pros outweigh the cons. A big part when addressing ethics is recognizing and exploring the moral right or wrong of an issue. Neonatal care can be justified by simply looking at the rates of survival in this specialty. It's important to realize that decision-making is not taken lightly. In fact, it's a whole process in which the medical professional considers the duties, rights, and character traits of the individuals involved. Likewise, when parents agree to such treatments, it's usually for the well-being of their children. But all in all, if it's such a dilemma, then what kinds of processes in regards towards decision-making should be applied when determining whether treatment should be provided, withdrawn, or withheld? What constitutes the best interests of children in high-risk areas? And finally, who should be allowed to choose over minors if doctors and parents are not suitable to some? To start, the biggest concern found in most, if not all, neonatal care intensive care units is the safety of their young patients. It's important to consider all aspects of ethical obligations in the medical field to ensure that the safety of these especially young and high-risk patients are met. Conversely, the dilemma begins with the uncertainty of the treatment and the care outcomes. The problem can and most often originates here because most treatments are relatively new and there is little to no information on the long-term effects that a patient can develop with time. There are so many unknowns that it makes it hard to make decisions. Parents may fear that their child may end up worse. This kind of predicament can be a potential life or death factor for a patient who may really need some kind of treatment and is unable to receive it because of the ethical dilemma that it puts either the provider or the parent of the child. In addition to safety concerns, another concern for parents and physicians when decision-making for an infant is the possibility of causing trauma by administration of intensive care. According to the AMA Journal of Ethics, these decisions do not occur in vacuum. Rather, they are complex interactions amongst parental concerns and rights, societal norms, which may be regional rather than national, and the neonatologist's opinions about viability and medical fertility. When babies are born early, have health problems, or a difficult birth, they go to hospitals, neonatal, and intensive care units. Acknowledgement that both life-saving and supportive care may cause injury to the preterm infant is crucial, yet in certain situations, the infant needs aggressive care to live. In cases like this, healthcare providers and parents must decide whether to continue maximal aggressive care or whether to provide less than optimal care in order to diminish the patient's suffering or later long-term outcomes. Moreover, another ethical conflict in relation to decision-making is the infant's inability to make logical decisions upon him or herself. And because infants are incapable of exercising autonomy, this creates another ethical issue, which is that infants have the right to health care. Autonomy, by definition, is the right of an individual to make decisions that affect their lives. The perplexed situation begins with the fact that an infant may or may not be considered viable because they are babies. And as a result of this issue, the problem arises on whether a neonate patient in high-risk areas should receive resuscitation and appropriate intensive medical care. Gray areas always arise from circumstances like this. For example, in religious situations, a parent may want to withhold their child from receiving a blood transfusion because of their religion. But when the blood transfusion can save that child's life, it becomes an ethical issue on whether you should respect the parent's religion or whether the provider should advocate for that child's health, because the child is not able to articulate what he or she wants since it is so young. In conclusion, although opinions vary from one person to another, the most important thing that should always remain a constant in the medical field is the well-being of a patient. I mean, that's what physicians sign up for. That's what parents sign up for when they have children. When it comes to making ethical decisions, duties, rights, and the character traits of all individuals should always be top priority. No one may ever know for sure which decision is correct or wrong, or which decision should be allowed, or which is more suitable. But even if that's the case, recognizing and exploring the moral rights or wrong of an issue is detrimental when addressing ethics in every part of the medical field. As part of my works cited page, some sources that I use include neonatal care, which by the Hastings Center. I found this online article that provides information amongst dilemmas in the NICU. I also by Eric Eichenwald, Physician and Parental Decision Making in Newborn Resuscitation, part of the Journal of Ethics, American Medical Association. I found another source to create this paper or this speech, and I also found another one called Ethical Dilemmas in Decision Making at Limits of Neonatal Viability. And then I also found some stuff from Kin's The Administrative Medical Assistant book with an applied learning approach, 13th edition. And then I also have another source called Ethical Dilemmas in the Neonatal Intensive Care Unit by the Mayo Clinic. Thank you.